be talking about dissociative identity disorder, and it is characterized as alternating between one or more personalities and/or identities. Each identity may have their own name, speak different languages, and unique characteristics. It could also be male or female. DID disrupts memory, attention, and identity. The symptoms associated with dissociative identity disorder can interfere with the person's general functioning. Since DID diagnosis has increased, it has been more controversial. The causes of dissociative identity disorder is said to derive from severe trauma, which commonly occurs before the age of 5 or having experienced a natural disaster, war, or neglect. These traumas occur mostly from physical, sexual, or mental abuse. After trauma occurs, a person suffering from DID tries to dissociate from this memory so it can cope with it. It is also thought that DID runs in families, hence the tendency to dissociate from certain events that occur could be hereditary.
Some symptoms of DID are the experience of split personalities, as well as hearing voices talking to the patient or taking control of them. Some other symptoms include depression, headaches, flashbacks, disorientation, anxiety or panic attacks, eating disorders, blackouts, time or memory lapses, visual or auditory hallucinations, suicide attempts, or self-injury. Some therapy for DID include psychotherapy with hypnosis, which is the most popular therapy to treat DID. During the process, the therapist attempts to make contact with the different personalities and form a relationship between them. The goal of the therapist is to enable the individual to achieve breakdown and unification of identities. The second treatment for DID is eye movement desensitization and reprocessing, or EMDR, which integrates the patient's traumatic events with personal resources. And the third therapy for DID is medication. Even though if there is no medication to treat DID, antidepressants or anti-anxiety drugs can help cope with the emotional symptoms the patient might experience. Caution is advised with the use of medication, as it can lead to the patients feeling controlled and eventually lead to feeling re-traumatized.
Some myths that are included in DID is one being DID is rare. Studies show that DID is as common in about 1 to 3% of people, making it just as common as schizophrenia and bipolar disorder. It's obvious when someone has DID. As usually portrayed in social media, DID isn't as easy to diagnose or as obvious. In fact, it may take several years for a person to be in a health mental institute before they are even diagnosed with DID. Three being people with DID have distinct personalities. Not certainly distinct personalities, people with DID have more different states, and they may act very differently in different states. 4 is treatment makes DID worse. Some critics of DID say that the treatment could make the disorder more unstable and cause re-trauma of the person. However, this is usually only in the case when uneducated therapists use outdated or ineffective approaches that could cause more damage. Therapists further develop and regard them as real or concrete, the self-states. Quite the opposite, therapists try to create an inner communication and cooperation between self-states. They teach patients to manage their feelings, impulses, and memories. Some famous people with DID include Marilyn Monroe. She's a legendary actress who grew up with DID. To treat her condition, Monroe also underwent some medications, but since she grew up in a foster home, she failed to overcome her condition. Britney Spears, who is a famous songwriter and a short-time actor, she suffered from DID. To treat her condition, she decided to stay in a hospital for thorough medications. And Herschel Walker, who's known as the best football player and played for the team of Philadelphia Eagles. According to Walker, he didn't remember winning the Heisman Trophy because of his undiagnosed DID.